And to finish, let's shift our focus to Delhi's pollution crisis, which has now become a daily, year-round reality, a chronic burden that millions are forced to breathe in every single day. The issue is no longer about protests, activism, or the dream of clear blue skies. Delhi residents let go of those privileges long ago. The crisis is directly affecting their health. In the latest revelation, new data shows just how severe this impact has become. More than 200,000 acute respiratory illnesses cases have been logged in just 6 central government hospitals between 2022 and 2024. The government has confirmed that over 30,000 of those patients were so severely affected that they needed hospitalisation. Data shows Delhi's 6 major hospitals recorded nearly 67,000 acute respiratory patients in 2022, 69,000 in 2023, and over 68,000 in 2024. And experts say this is strongly linked to the city's perpetual toxic air. The new statistics underscore how deeply Delhi's air quality is impacting public health. For weeks now, the capital's air quality index has been sitting at levels over 20 times higher than the limit recommended by the World Health Organization. These levels are not just unhealthy, they are dangerous even for healthy individuals and extremely risky for children, the elderly, and anyone with existing health issues. Health experts say there is no single source behind Delhi's air crisis. They point to a complex mix of industrial pollution, vehicle exhaust, stubble burning in neighbouring states, and winter weather conditions that trap pollutants close to the ground. Low wind speed and dropping temperatures only make this air even harder to disperse. And on the ground, the frustration is palpable. Many Delhi residents say this crisis has been building for more than a decade with no real long-term fix in sight.
ये पोल्यूशन अब से थोड़ी 10 साल से 15 साल से चल रहा है। इसका कोई स्थायी इलाज नहीं है जब तक सरकार इसके ऊपर गंभीर रूप से काम नहीं करेगी। आप सोच रहे हो गाड़ियां बंद करा दो, इवन रोड करा दो, इससे कोई फर्क नहीं पड़ने वाला। टारगेट रखो कि साल के कम से 2 करोड़ पेड़ दिल्ली में लगाने हैं। ये टारगेट रख के चलो आप सोचोगे आज गाड़ी बंद करा दूँ, कल बिल्डिंग बंद करा दूँ, सरकारी बिल्डिंगों के काम चल रहे हैं, प्राइवेट बंद कर देते हो। इससे कहाँ पोल्यूशन रुकेगा? और कोई सरकार गंभीर नहीं है। पराली हजारों सालों से चल रही है, तब दिल्ली में पोल्यूशन नहीं आता। एक ही महीने सोचते पोल्यूशन है, पूरे साल की ये हालत है दिल्ली में।
The Health Ministry says polluted air acts as a triggering factor for respiratory illnesses. Because people have different lifestyles, immunity levels, and medical histories, some are hit much harder than others. To track these patterns, the National Centre for Disease Control is now monitoring air-related illnesses in more than 230 surveillance sites across the country, along with a digital ARI tracking system launched last year. A recent multi-hospital study by the Indian Council of Medical Research also found that when pollution levels spiked, so did emergency room visits for breathing difficulties. However, the government has been cautious in its wording, saying that while the trend is clear, the data cannot prove a direct causal link. The Delhi High Court is now hearing a petition seeking urgent action to control air pollution. These numbers tell a clear story. Delhi is not just losing visibility, it's losing its lungs. And that loss is now showing up in hospitals every single day.
I rose from the army with medals on my chest. I spoke of freedom from colonial chains, but I tightened my own. I filled prisons with ghosts. Nearly 500,000 people were butchered under my rule, and I trusted only my paranoia. I gave myself grand titles. I claimed to be Africa's strongman. History calls me something else, the dictator. Who am I?